To enlighten us on this issue, we have online with us is Eskild Peterson from the Ministry of Health. Mr. Peterson, welcome to our bulletin. And can you hear me?
Yes, thank you very much.
Very good. We would like you to give us a general picture of the situation right now in the country, because many people are a bit worried about the situation right now, since two were announced, and then apparently just a few minutes ago that we were told another two are there. So we would like to confirm with this.
Yes, the situation in our region of the world changed over the weekend when it became clear that there was a major outbreak in Iran. Iran is a popular destination for Omanis, not least for religious reasons, and therefore it is not a surprise that we have Omanis coming back to Oman with infections. But it's important to stress that all 4 Omanis who is now infected, they got the infection in Iran and not in Oman. So we do not at the moment see infections between Omanis in Oman. It's only people who were infected outside.
Now, we know that it is normal actually for some people who have contacted COVID-19 to be at home, and they should actually prevent themselves from integrating with other people actually. Now, people would like also to be reassured. Is this fine for them to be at home?
Yes, we think so, absolutely. Home quarantine is a sociable, acceptable way of isolating you from the rest of the society. It was extensively tried in Canada during the SARS outbreak in 2003, and it's much more, what shall I say, benign form of quarantine than quarantining you outside of your home. These 4 cases, they have a mild disease. There's no medical reason for them to be admitted to hospital. So we think this is the right way of doing it to both keep the patient comfortable and protect the community.
Then in general, what can an individual or people in general can do to prevent the infection?
Well, right now, the only thing you can actually do is to follow the news bulletins from the ministry. If the situation changes, as it will, we will keep the public informed. And the main issue is to avoid mass gatherings. So meetings where you have many people together in a small space, that is really where there is a risk of infection, because the infection goes from one person to another by droplets. But at the moment, there's no risk of being infected inside Oman. These 4 people are related to foreign travels, but of course, this may change in the coming days. We don't know.
Now, some of families, they ask actually, what about my children? What do I do with them? They go to school, they mix with others. What advice would you like to give them?
For the time being, there is no specific advice. What people should know is that a peculiar thing with this new virus is that it seems that it do not really attack people below 18 years. So children, for some reason we don't understand, they are not a high-risk group. So I would say that if there is sustained transmission in Oman, perhaps we should close the schools, but for the time being, there's no reason to do anything. And in any case, people should rest assured that this is apparently not an infection which has a high attack rate in children. Actually, it's quite rare that children get infected.
Well, Mr. Eskild Peterson from the Ministry of Health, an expert in this particular area, we would like to thank you very much. We do hope the public will not very much worry about the situation. Is well under control. The authorities in the Ministry of Health keep following those 2, and I believe the 2 that just have been informed, we are yet actually to confirm on that one, but we would appreciate to continue communicating with the concerned authority in the Ministry of Health to clarify on that one. So thank you very much.